Hello, my name is Temitope Shevanjo. In this video, I'm going to be demonstrating NG insertion and removal, then ostomy care. To start with, I'm going to be checking the PCP order and care plan. So, I've been able to check the PCP order and a care plan. I will now gather the supplies and equipment that I need to use for my patient. I haven't gone through the order. I have a Salem sum, which is right here, a pen light, a tissue, MS's basin, a cup of water and straw, a towel, tape, safety pin, and a mouth swab. So, with all this, I've been able to gather all the equipment I'm going to use for my patient. So, I'm going to step back, perform hand hygiene, and I'm going to put on a clean glove. With my clean glove, I'm going to provide privacy, and I'm going to introduce myself to my patient. Hello, my name is Temi. I am a student nurse from Mountain View College. I'm here to insert your NG tube this morning. May I verify your first and last name and your date of birth? Okay. Jackie Smith. Thank you, Miss Jackie. And your date of birth? 03/06/1972. Thank you, Miss Jackie. I've been able to confirm that looking at her wrist. Perfect. Miss Jackie, if I may ask, do you have any allergy? Can you swallow? Good. I have even seen in your order that you're allowed to drink water while we are inserting the tube, which means you can swallow. Very good. Thank you, Miss Jackie. So I'm going to briefly tell you what we're going to do majorly today. Miss Jackie, I'm going to be having with you here to your access your MS's basin in case you need to throw up, and here a cup of water and a straw that you need to sip while we are in the procedure of inserting the tube. Then a tissue for you to clean up in case you need it. Here are the three within your reach. Please feel free to pick them whenever you know you need them. So the next thing I'll do is I'm going to adjust the bed to a working height, and I'll make sure your head is in a valid position. Good. Then I'm going to be assessing for a gag reflex and cough reflex. Miss Jackie, can you please cough for me? Thank you. That's nice. Can you gag? Okay, good one. Very good. Miss Jackie can cough and gag. Miss Jackie, I want to choose nurse. Can you please cover your nose this side with one finger and breathe in and breathe out? Breathe out. Do the other side. Have you had any surgery in the nose? Any injury? None. Good. So I'll be assessing her skin. Miss Jackie do not have any surgery or any injury, so the two nerves are good and I can use any of the two for my insertion. So I'm going to be shining my pen light to assess her skin for break of tissue, skin tissue, or any bruises. So looking at, oh, this is perfect. Miss Jackie looks good. There is no bruises, no tissue break, anything noticed. So that's fine. That's okay. So Miss Jackie, you are ready and you're good to go. Now, I'm going to place this on your chest. So I'm going to be needing this on your chest. And for safeguard purpose, please, in the process of inserting the tube, Miss Jackie, if you feel like gargling or you are feeling very uncomfortable, please raise your finger. That is to tell me to stop, that you are not comfortable and you don't want me to continue. Is that okay by you? Do you understand? Perfect. Okay. The next thing I'll do is I'm going to be measuring 3 tapes right here. The 3 tapes I'm going to use to safeguard the tube after I insert it. So the first tape will be 4 inches long. I'm sorry, something wrong with my tape. I don't know. The last person that used this tape there. Okay, I've been able to 4 inches long. I'm going to cut the 4 inches long, and I'm going to part it into 2, but not the whole. I'm going to part like 3 inches this way, and I'm going to step it to the bed right here. So the second one is going to be to fasten to the dress of the patient, and the very last one, the shortest one, is the one I'm going to use to mark. This will be my marker to mark the tube when I measure. So I've been able to do that. So Miss Jackie, I'll be with you shortly. Now I'm going to take my tube from the bag, and I'm going to measure. I'm going to measure, and the measurement will start from the tip of the nose to the earlobe and to the signal process. This way, I'll put the tube right here to the earlobe and to the signal process. So I got 43 right here, 43. So I'm going to place the smallest tape that I cut, 43. I'm going to use it as my marker. Here is my marker for today. So I've been able to put my marker here. Here is my marker. So the next thing I'll do is I'm going to lubricate. From my supply, I'm supposed to have a water soluble lubricant, but I don't have. I'm going to pretend I have a water soluble lubricant. I'm going to lubricate 4 inches of the tube. So I'm going to pretend here is a soluble lubricant, water soluble lubricant. I've been able to lubricate 4 inches of the tube. Then I'm going to administer. Please, Ms. Smith, I'm going to be administering your tube right now. I'm ready. Here is your cup of water. Feel free to grab this and zip while we are administering. And don't forget, raise your hand when you feel like gargling or you feel very uncomfortable. Is that okay by you? So I'm going to insert the tube. There is an instruction that says do not force the tube. So I'm going to start inserting the tube. Here you go. And I'm going to insert it gently and quickly. So I reached 43 where I marked my tape. That is where I'm going to stop. Now I stopped because I already marked the length at which I'm going to go. So we're going to stop here, and the tube goes here right this way. The next thing is I'm going to provide safety by using the tape I cut. This one, I'm going to put it on the nose, on the tip of the nose, this way. So this side goes under here and it goes this way. Provide safety. And the other one comes under here and goes this way. And here you go. This is to provide safety for the tip, you see. So the next thing I'm going to do is I'm going to take the last tape which I have here. I'm going to fasten the tube to the dress of the patient this way, and I'm going to use my safety pin here. So that is my tube insertion. And in order for me to confirm if the tube is correctly placed, there are two ways to go about that. Is either we use the x-ray or we are testing the pH level. It depends on the recommendation of the facility. So for this patient, after x-ray verification, I've been able to confirm that the x-ray is right, the tube is rightly placed, correctly and rightly placed. So I'm going to take off my hand glove, perform hand hygiene, and I'll make sure I lower my bed. I take off this and I make sure my patient is in good condition. So Miss Jackie, don't forget this. That is for the tube insertion. And for the removal of the tube, the next thing I'm going to do, I'm going to confirm. I've stepped out of the room. Now stepping back in, I'm going to perform hand hygiene again, and I'm going to put on a new glove. So in doing that, let me get a glove. I'm going to put on a new glove. So I'm going to confirm my patient again. Miss Jackie, are you okay? You're doing good? So what I'll do, I've been able to verify her. Then I'm going to place the towel on her chest again, so that any stain will not go on her cloth. So with this, I'm going to remove the suction in case the tube is connected to the suction on the wall. I'm going to take off this, I'm going to disconnect that. Then the next thing I'll do is I'm going to remove all the safety measure I put. So I'll take off the safety pin, put that in trash. I'll take this one off too. The tape I put on her dress. Take this off. Then the one on her mask, I'm going to take it off. So I've been able to take that off. Everything goes into the trash. Now, I'm not going to take off the tube, but I'm going to tell my patient to take a deep breath. The patient to take a deep breath and hold the breath until I take out the tube. So I'm going to smoothly and quickly remove the tube. Miss Jackie, please, I want you to take a depth, and please hold the depth. I'm ready to take off your tube. So I'm going to go by this, and gently and smoothly and quickly remove the tube. Then I'm going to make sure I discard the tube in the trash bin. So I discard that in the trash bin. So I've been able to do that. I'm going to take off my hand glove, perform hand hygiene. I'll take off all this that I used, take off the towel, take off this, and in case is a patient that needs to drink, like Miss Jackie, she's allowed to drink water in the process of inserting the tube. I'm going to give her a drink, but before then I'm going to clean her face. I'm going to clean and make sure I provide care by cleaning her face, and that is that for the removal of the tube. So the next thing I'll be doing is the ostomy care. So now I'll place the bed back into the lower position and put back the rails. Now, in doing the ostomy care, I'll have my patient head in supine or flower position, right? Or flower position, head in supine or flower position. I'm going to perform hand hygiene, and I'm going to put on a new glove. But then I'm going to verify, order, and confirm the date of birth of my patient. I'm going to verify, order, and confirm the Date of birth. Miss Jackie, one moment please. For this patient, for the purpose of this video, I'm going to fix the pouch first and then to remove. So I need a warm water here. I have a warm water here with a washcloth, and warm water. I have the stoma measurements here, and I have my pouch. I have clamp. I have my scissors. I have my flange, and I have with me here a bed pad. Here is a bed pad that I'm going to use. So look, first thing I'll do is I'll verify a date, name and date of birth. Can you please verify for me your name? Jackie Smith. Thank you. Date of birth 03/07/1972. Thank you, Miss Jackie. That's perfect. Good. So I'm going to assess our skin. In assessing the skin, I'm going to be looking for the color. The color I'm looking for is red, which is what I have on Miss Jackie. She looks good. But if it were other color, like is a color red, is a color black, or is dark blue, I'm going to make sure I report to the provider. So now I'm going to raise my bed to a working height, and I've been able to see the stoma. Now what I'll do is I'm going to put my washcloth in the warm water, and I will be able to clean gently, softly, but deep cleaning around the stoma. I'll make sure I clean very, very well. So I've been able to clean. So I'll leave it to here dry, though it's not a damp water, so I'll put that aside. After doing that, I'm going to take off my hand glove. I'm going to perform hand hygiene, and I'm going to be done in a new glove. So I'm going to put a new glove. So I have a clean glove. I've been able to clean. In case there is a continuous drainage, for some cases, you can put gas. But for Miss Jackie, she's okay. So what I will do next is I'm going to be measuring the stoma with the stoma measurement. From what I have here, I have different sizes. So if I put this is too big, this is too big, this is too big. No, this is our exact size. No, this is too big, this is too big, and let me use this. Oh, this looks good. What I'm looking for is I'm going to look for a size that is 1/8 or 1/16 inch larger than the size of the stoma, which is this one, and it is this size I'm going to put at the back of my flange before I can cut. So I'm going to take my flange out of the bag, and I'm going to place it. I'll place the stoma measurement on it, and I'll be able to look for the number. And from the number I can see here, I see 45. So I'll put the measurement here. Lest I forget, before I clean, I forgot to put my pad, a waterproof pad. I just remember I'm going to fix it under my patient in order to avoid the bed being wet. So right here, I'm going to have my scissors, and since I measured 45, I'm going to be cutting 45. So I've been able to cut 45, and I'll take this out, put this in trash. Then I'm going to first of all fix the flange. I'll take off this. I will apply the flange first properly and adhere to the skin. So I'm going to put the flange this way, right here, adhere to the skin in a way that it will be convenient and it will not disturb the patient. Then I'm going to take off this. So, perfect. So, I will access for the seal. You can see it's rightly and neatly placed. Then, the next thing I'm going to do is I'm going to snap my pouch. So I'm going to snap my pouch. I'm going to carefully snap my pouch. So on the skin. Good. I'm going to access for the seal. Very good. It's well placed. So that there won't be any leakage of any sort. So now I'm going to use the clamp. It's a reusable one. I'm going to move the tip of the pouch up, and I'm going to fix the clamp this way. So I have it in. There you go. So I've been able to fix my clamp, tighten it, and before that I will have my patient. I'll put my hand in order to assert pressure. Even before I do the clamp, I'll ask my patient to put a hand under it for us to apply pressure. So this I'm doing to make sure that the pouch is firm on the patient. So after doing this, now in order for me to remove the pouch, I'm going to push the skin back a little bit, and I'm going to take off the pouch. I'm going to take off the pouch, and I'm going to remove everything from the patient's skin, but I'm going to be very careful. But before doing that, I'll first drain the pouch. In draining the pouch, I'll have a bedpan beside me or to the toilet. I will measure the liquid content if it is required, and I will wash the characteristics of the stool. So I will have a bedpan here around me, and if it requires me to go to the toilet, I'll do that. Then I'll take off the clamp carefully and gently. Don't forget I said the clamp is reusable. I'll take it off. Then I'll drain the whole content after measuring. I'll drain the whole content completely. Then I'll make sure I remove gently from the skin. I'll remove gently. So I'll be able to remove the clamp gently. Then I'll put into the trash. Then I'm going to perform hand hygiene. I'll remove the glove and perform hand hygiene. Then before I take off my glove, I will have taken the ped pad again, since I've been able to do everything I see is clean. And in case I need to clean the patient, I'll put a new glove and clean the area of the stomach. After doing everything, I'm going to make sure that I have the call light, and I'll educate my patient. In case you need me, please call me. I'll provide the call light by her bed, and I'll document everything I've been doing so far. I'll make sure I return the bed and the side rails. I'll fix everything appropriately and make sure the client is comfortable. Thank you.